A woman's menstrual cycle is a vital indicator of her reproductive health, and irregularities in the cycle are often one of the earliest signs of infertility. Typically, a healthy menstrual cycle ranges between 21 to 35 days, with the average being about 28 days. When periods become unpredictable, consistently too long, too short, or entirely absent, it may signal an underlying issue affecting fertility. Irregular menstrual cycles mean that ovulation, the release of an egg from the ovary, may not be happening regularly or at all. Ovulation is essential for natural conception because it provides the egg necessary for fertilization. If a woman isn't ovulating consistently, her chances of becoming pregnant naturally are significantly reduced. Some women may ovulate occasionally, while others may not ovulate at all, and this inconsistency can make it extremely difficult to conceive. There are several reasons why a woman might experience irregular periods. Hormonal imbalances, particularly involving hormones like estrogen and progesterone, are a common cause. Conditions such as polycystic ovary syndrome, PCOS, often lead to hormonal disruptions that interfere with ovulation and cause irregular or missed periods. Thyroid disorders, both hypothyroidism and hyperthyroidism, can also affect menstrual regularity and in turn impact fertility. In some cases, extreme stress, sudden weight gain or loss, or excessive exercise can disrupt the hormonal balance needed for a normal cycle. For instance, athletes or individuals with eating disorders may experience irregular periods due to reduced levels of body fat, which are essential for maintaining hormonal health and reproductive function. Tracking the menstrual cycle is an important tool for identifying irregularities. Women are encouraged to keep a menstrual calendar or use tracking apps to monitor the length, flow, and any symptoms associated with their period. If patterns of irregularity are noticed, such as missed periods for multiple months, drastic fluctuations in cycle length, or cycles that consistently fall outside the normal range, it's important to seek medical advice. While 1 or 2 irregular cycles in a year may not be a cause for concern, persistent irregularity should not be ignored. It could be a warning sign that something is interfering with ovulation or hormonal balance, both of which are critical for fertility. Early diagnosis and appropriate treatment can help manage the condition and improve the chances of conception. Painful periods, also known as dysmenorrhea, can be more than just a monthly inconvenience. While mild cramps during menstruation are common and considered normal, intense and persistent pain that interferes with daily activities may be a sign of an underlying reproductive issue that could affect a woman's fertility. This type of pain should not be dismissed as a routine part of the menstrual cycle, especially if it worsens over time or is accompanied by other symptoms such as heavy bleeding, fatigue, or pain during intercourse. One of the most common causes of painful periods linked to infertility is endometriosis. This condition occurs when the tissue that normally lines the inside of the uterus begins to grow outside the uterus, attaching itself to other pelvic organs such as the ovaries, fallopian tubes, and bladder. These tissue growths continue to act as they would inside the uterus, thickening, breaking down, and bleeding with each menstrual cycle. However, because the blood has nowhere to go, it causes inflammation, pain, and scar tissue formation. Endometriosis can significantly affect fertility by distorting the reproductive organs, blocking fallopian tubes, or disrupting ovulation. Another potential cause of severe menstrual pain is pelvic inflammatory disease, PID, an infection of the female reproductive organs often caused by sexually transmitted bacteria. If left untreated, PID can cause scar tissue and abscesses to develop, leading to chronic pelvic pain and damage to the fallopian tubes, increasing the risk of infertility. Uterine fibroids, non-cancerous growths in the uterus, can also lead to painful periods and may impact fertility depending on their size and location. Fibroids can interfere with the implantation of a fertilized egg or block the passage of sperm through the uterus. It is important to note that some women may also have a condition called adenomyosis, in which the inner lining of the uterus breaks through the muscle wall of the uterus. This can cause severe cramping and heavy bleeding, and may also contribute to difficulties with conception. Women experiencing severe menstrual pain should consult a healthcare provider for a proper diagnosis. Identifying the root cause early allows for treatment options that may preserve fertility. Ignoring painful periods or relying solely on over-the-counter pain relief can lead to missed opportunities for early intervention, especially if the cause is a progressive condition like endometriosis. The nature of a woman's menstrual flow, whether it is unusually heavy or abnormally light, can provide important clues about her reproductive health and potential fertility issues. Changes in the amount, duration, or consistency of menstrual bleeding may indicate underlying hormonal imbalances or structural problems within the reproductive system that could interfere with the ability to conceive. Heavy menstrual bleeding, known as Amenorrhea, is more than just a nuisance. It can be a symptom of several conditions that impact fertility. For instance, women with uterine fibroids, benign tumors in the uterus, often experience excessive bleeding during periods. Depending on their size and location, fibroids can distort the uterine cavity, hinder implantation of a fertilized egg, or obstruct the fallopian tubes, thereby contributing to infertility. Endometriosis is another common cause of heavy bleeding. The presence of endometrial-like tissue outside the uterus not only causes pain, but can also affect normal uterine function and increase menstrual blood loss. Hormonal disorders, such as thyroid dysfunction or polycystic ovary syndrome, PCOS, can also disrupt normal menstrual patterns. In PCOS, an imbalance in reproductive hormones may prevent regular ovulation and lead to irregular or scant periods. In some cases, women may go months without a period and then experience very heavy bleeding when menstruation does occur. This hormonal chaos can make it difficult to track ovulation and time intercourse for conception. On the other hand, extremely light periods or spotting may also be a concern. A light flow, especially if it replaces a once normal period, might be a sign of low estrogen levels. Estrogen is a key hormone responsible for building the uterine lining. Without a thick, healthy lining, the uterus may not be able to support the implantation and growth of an embryo, leading to infertility or early pregnancy loss. Light periods can also occur in women with a condition called hypothalamic amenorrhea, often caused by stress, excessive exercise, or significant weight loss, all of which suppress ovulation and reduce menstrual flow. Monitoring changes in menstrual flow over time can help identify these warning signs. Women who notice a sudden shift in the heaviness or lightness of their periods, especially if accompanied by other symptoms like fatigue, pelvic pain, or missed cycles, should consult a healthcare provider. These changes may be the body's way of signaling that something is disrupting the reproductive process and needs medical attention. The complete absence of periods, a condition known as amenorrhea, is a significant sign that a woman may be experiencing fertility problems. While it's normal for periods to stop during pregnancy, breastfeeding, or menopause, amenorrhea outside of these situations often indicates an underlying issue that may prevent ovulation and, in turn, hinder the ability to conceive. Amenorrhea is classified into two types, primary and secondary. Primary amenorrhea refers to the situation where a young woman has not started menstruating by the age of 15 or 16. This can be due to genetic or developmental conditions affecting the ovaries, uterus, or hormone-regulating glands like the pituitary or hypothalamus. Secondary amenorrhea, on the other hand, occurs when a woman who previously had regular periods suddenly stops menstruating for 3 months or more, or for 6 months in the case of women with previously irregular cycles. There are many possible causes of secondary amenorrhea, and many are closely related to fertility issues. Polycystic ovary syndrome, PCOS, is one of the most common culprits. Women with PCOS often experience irregular or absent periods due to hormonal imbalances that disrupt ovulation. Similarly, thyroid disorders, both underactive and overactive, can affect menstrual function by interfering with hormone regulation. Another common cause of amenorrhea is hypothalamic dysfunction, which results from extreme physical or emotional stress, excessive weight loss, or intense physical exercise. These factors can suppress the hypothalamus, a part of the brain that signals the body to produce reproductive hormones. When the hypothalamus is not functioning properly, it can shut down the hormonal signals needed to trigger ovulation and menstruation. Certain medications, including some forms of birth control or treatments for psychiatric conditions, may also lead to absent periods. Additionally, chronic illnesses, eating disorders such as anorexia or bulimia, and premature ovarian insufficiency, early menopause, can all contribute to amenorrhea and related fertility challenges. Regardless of the cause, the absence of periods typically means that ovulation is not occurring regularly, if at all. Without ovulation, there is no egg available for fertilization, making conception extremely difficult. Women who have missed several periods and are not pregnant should seek medical evaluation to determine the underlying cause. Identifying and addressing the condition early can increase the chances of restoring normal menstrual cycles and improving fertility outcomes. Hormonal imbalances play a crucial role in female fertility and are often one of the key reasons why some women struggle to conceive. Hormones are the body's messengers, controlling everything from the menstrual cycle to ovulation and even the maintenance of a healthy pregnancy. When these hormones are not functioning in harmony, the reproductive system can be significantly affected, often leading to difficulty getting pregnant. One of the most visible signs of hormonal imbalance is unexpected changes in physical appearance or bodily functions. Women may notice unusual weight gain, especially around the abdomen, that doesn't respond to diet or exercise. This can be a result of insulin resistance, commonly seen in women with polycystic ovary syndrome, PCOS, a condition marked by high levels of androgens, male hormones, and disrupted ovulation. PCOS is one of the most common hormonal disorders linked to female infertility. Excessive hair growth on the face, chest, or back, called hirsutism, is another common sign. It's typically caused by elevated levels of male hormones. On the flip side, thinning hair on the scalp or noticeable hair loss may also indicate hormonal disturbances. Acne that appears in adulthood, particularly on the jawline or chin, can also be tied to elevated androgens. Low estrogen or progesterone levels can impact the menstrual cycle and fertility. Estrogen helps regulate the development of the uterine lining, which is critical for implantation of a fertilized egg. Progesterone, on the other hand, helps maintain the uterine lining to support early pregnancy. If these hormones are out of balance, a woman may experience irregular periods, spotting between cycles, or difficulty sustaining a pregnancy. Thyroid hormones are equally important. An underactive thyroid, hypothyroidism, can cause fatigue, cold intolerance, and weight gain, while also interfering with ovulation. An overactive thyroid, hyperthyroidism, may lead to weight loss, anxiety, and irregular periods, and can also affect fertility. Mood changes, sleep disturbances, and decreased libido may also be subtle indicators of hormonal imbalance. These symptoms are often overlooked or mistaken for lifestyle issues, but they can be signs that the endocrine system is not functioning properly. Recognizing these symptoms early and seeking medical attention for proper hormonal testing can help identify treatable causes of infertility. With appropriate treatment, many women with hormonal imbalances can restore ovulation and improve their chances of becoming pregnant. Pain during intercourse, medically known as Dyspareunia, is a symptom that is often overlooked or dismissed, yet it can be a significant indicator of underlying reproductive health problems that may impact a woman's fertility. While occasional discomfort during sex may occur for various harmless reasons, persistent or recurring pain, especially deep pelvic pain during penetration, is not normal and may signal conditions that interfere with a woman's ability to conceive. One of the most common causes of pain during intercourse is endometriosis, a condition in which tissue similar to the lining of the uterus grows outside the uterus. This misplaced tissue can attach to the ovaries, fallopian tubes, and other pelvic organs, causing inflammation, scar tissue, and severe pain. The scarring can affect the shape and function of reproductive organs, leading to fertility issues by blocking the fallopian tubes or preventing proper egg release and implant. Pelvic inflammatory disease, PID, is another condition often associated with painful sex and infertility. PID is usually caused by untreated sexually transmitted infections, such as chlamydia or gonorrhea, and leads to inflammation and infection of the reproductive organs. Over time, PID can cause permanent damage, including scarring and blockages in the fallopian tubes. Ovarian cysts and fibroids can also lead to painful intercourse. Cysts, especially if large or ruptured, can cause pressure or sharp pain during sex. Fibroids, non-cancerous growths in the uterus, can distort the uterine cavity or create pressure against other pelvic structures, leading to discomfort. Depending on their size and location, fibroids can also interfere with implantation or embryo development, contributing to fertility challenges. Vaginal dryness, often linked to low estrogen levels, can also make intercourse painful. This is commonly seen in women with hormonal imbalances, those on certain medications, or women experiencing premature ovarian failure or early menopause. Pain during sex from dryness may discourage frequent intercourse, further reducing the chances of conception. Because many of these conditions are treatable, it's important not to ignore pain during intimacy. Women experiencing regular discomfort should consult a gynecologist for a thorough evaluation, which may include pelvic exams, imaging tests, or hormone assessments. Early diagnosis and treatment can not only alleviate pain, but also improve reproductive outcomes and increase the chances of a successful pregnancy. Recurrent miscarriages, defined as the loss of 2 or more consecutive pregnancies, can be an emotionally devastating experience and may also indicate an underlying fertility issue that needs medical attention. While a single miscarriage is relatively common and often occurs due to random chromosomal abnormalities, repeated pregnancy loss suggests that there may be a chronic problem affecting a woman's ability to carry a pregnancy to term. There are multiple potential causes for recurrent miscarriages, many of which are directly linked to a woman's fertility. One of the most common causes is genetic or chromosomal abnormalities, either in the embryo or carried by one of the partners. Structural problems with the uterus, such as uterine septum, a partition within the uterus, fibroids, or scarring from previous surgeries or infections, can also prevent the embryo from implanting properly or growing in a healthy environment. Hormonal imbalances are another key factor. For instance, insufficient levels of progesterone, a hormone necessary for maintaining the uterine lining during early pregnancy, can lead to early pregnancy loss. This condition is often referred to as a luteal phase defect. Similarly, thyroid disorders, whether overactive or underactive, can disrupt hormone regulation and affect pregnancy viability. Autoimmune conditions, such as antiphospholipid syndrome, can also contribute to recurrent miscarriages. This disorder causes the immune system to mistakenly attack normal proteins in the blood, leading to clot formation that can interfere with the placenta's ability to nourish the growing embryo. Blood clotting disorders, even without autoimmune involvement, can also pose similar risks. Infections that affect the uterus or reproductive tract may damage the endometrial lining or cause inflammation that impairs embryo development. Chronic endometritis, a persistent inflammation of the uterine lining, has been linked to repeated miscarriages in some women. Age is another factor that increases the risk of miscarriage. As a woman ages, particularly after 35, the quality and quantity of her eggs decline, increasing the likelihood of chromosomal abnormalities in embryos and resulting in higher miscarriage rates. For women who have experienced multiple miscarriages, a thorough fertility evaluation is crucial. This may include genetic testing, hormone assessments, imaging studies of the uterus, and blood tests to screen for clotting or autoimmune issues. Identifying the cause of recurrent miscarriages can guide treatment options, such as hormone therapy, surgery, or lifestyle adjustments, and significantly improve the chances of a successful pregnancy in the future. Chronic pelvic pain is a persistent discomfort or aching in the lower abdominal region that lasts for 6 months or more, and it can be a sign of underlying reproductive health problems that may contribute to infertility in women. Unlike occasional menstrual cramps or transient abdominal discomfort, chronic pelvic pain often signals a more serious condition that affects the uterus, ovaries, fallopian tubes, or surrounding structures. For many women, this pain can disrupt daily life and may be accompanied by other symptoms such as fatigue, painful menstruation, or discomfort during intercourse. One of the most common causes of chronic pelvic pain related to infertility is endometriosis. In this condition, tissue similar to the lining of the uterus grows outside the uterus, adhering to organs such as the ovaries, fallopian tubes, or bladder. These tissue implants respond to hormonal changes during the menstrual cycle, causing inflammation, scarring, and severe pain. Over time, endometriosis can lead to blocked fallopian tubes, adhesions between pelvic organs, and impaired egg release, all of which interfere with the ability to conceive naturally. Pelvic inflammatory disease, PID, is another major cause of chronic pelvic pain, and is often the result of untreated sexually transmitted infections like chlamydia or gonorrhea. PID can lead to scarring of the fallopian tubes, chronic inflammation, and damage to reproductive organs. Even after the initial infection is treated, lingering inflammation and scar tissue can cause ongoing pain and permanent fertility problems. Ovarian cysts, particularly when they become large or rupture, can also contribute to chronic pelvic discomfort. Some types of cysts, like those seen in polycystic ovary syndrome, PCOS, are associated with hormonal imbalances that can lead to irregular ovulation and infertility. Additionally, fibroids, non-cancerous growths in the uterus, may cause constant pelvic pressure, especially when they grow large or are located in areas that distort the uterine cavity. In some cases, pelvic pain may stem from interstitial cystitis, also known as painful bladder syndrome or irritable bowel syndrome, IBS, both of which can mimic gynecological conditions. While not directly related to reproductive organs, these conditions can complicate diagnosis and delay appropriate treatment for infertility causes. Women experiencing chronic pelvic pain should not ignore their symptoms or rely solely on over-the-counter pain relief. A thorough medical evaluation, including pelvic exams, imaging studies like ultrasounds or MRIs, and sometimes laparoscopy, is essential to determine the exact cause. Addressing chronic pelvic pain early can improve quality of life and significantly enhance the chances of achieving a successful pregnancy. Unexplained infertility is one of the most frustrating and emotionally challenging diagnoses a woman or couple can receive when trying to conceive. It occurs when all standard fertility tests, including hormone assessments, ovulation tracking, semen analysis, and evaluations of the uterus and fallopian tubes, come back normal, yet conception still doesn't happen, after a year or more of trying. In essence, there is no clear medical reason found to explain why pregnancy has not occurred, even though both partners appear to be healthy and fertile on paper. This diagnosis does not mean that there isn't a problem. Rather, it means that current testing methods have not been able to identify it. There could be subtle factors at play that are difficult to detect with routine exams. These may include poor egg or sperm quality that isn't revealed in basic tests, issues with embryo development, minor imbalances in hormones that fluctuate during the cycle, or undiagnosed immune system problems that interfere with implantation. Some researchers also suspect that there may be microscopic issues with the endometrial lining that prevent proper attachment of the fertilized egg, or that sperm and egg are not interacting correctly at the cellular level. Even factors such as mild endometriosis, which may not be visible on an ultrasound or detected through typical screenings, could be contributing to infertility without showing obvious symptoms. Age plays a significant role in unexplained infertility as well. For women over the age of 35, fertility naturally declines, even if menstrual cycles remain regular. Egg quality diminishes with age, making fertilization and successful implantation less likely, even if ovulation appears normal and hormone levels are within a healthy range. Lifestyle factors, while sometimes overlooked, may also contribute to unexplained infertility. High levels of stress, poor nutrition, exposure to environmental toxins, excessive alcohol or caffeine consumption, and lack of adequate sleep can all impact reproductive function in subtle ways. For couples facing unexplained infertility, treatment usually begins with less invasive options like lifestyle adjustments or timed intercourse. If these approaches are unsuccessful, doctors may recommend fertility treatments such as intrauterine insemination, IUI, or in vitro fertilization, IVF, which can help bypass potential undetected barriers to conception. Although the term unexplained can feel discouraging, many women with this diagnosis go on to have successful pregnancies with the right support and medical intervention.